Thanks for joining us. In this short video, you're going to see the first recorded application of a technique that we call the Phoenix sign. This is done with a small infiltration of a local anesthetic called Lidocaine next to the common perineal nerve. This causes some vasodilation, which gets more blood supply to the nerve that's being entrapped. A patient will either get more motor strength or not get any motor strength. If they improve with motor strength, you'll note that this is a positive Phoenix sign. Rosaline has given us permission to share this video so that other people in the world can be properly diagnosed with their peripheral nerve entrapment. You'll see that after we infiltrate a small amount of lidocaine, she's able to regain nearly 100% of her motor strength, which she had not had for years prior to this. So thanks for joining, and I hope you enjoy this short video. We're here with Rosaline, and she has a common perineal nerve entrapment bilaterally. Today we're going to evaluate the right side. We've done blocks on her previously, which were able to demonstrate an increase in motor strength after infiltration of about 1 cc of lidocaine. We're able to infiltrate a very sub-anesthetic dose with the use of the diagnostic ultrasound. So, Rosaline, can you show how much strength you have in this big toe? Pull it up. Hold it up now against my force. Hold it up. Is that the best you can do?
Yes.
That's the most strength that you have?
Yes.
Okay. Now we're going to give her a peripheral nerve block under ultrasound guidance, and then we're going to come back and evaluate her strength. The location of the block as well as the ultrasounds. This is a short-axis diagnostic ultrasound view of the common perineal nerve. The head of the fibula is right here. This is the common perineal nerve that we can see that is somewhat oval in shape. This visualization will allow us a very small dose to be administered, which will give her a sub-anesthetic dose and allow for an evaluation of motor strength post-injection. As we can see on the screen, we're in an out-of-plane administration, but you can see that I'm infiltrating some just superficial to the fascia. I need to be slightly deeper. And you can clearly see the anesthetic going around the nerve. And we've administered about 3/4 of a cc. Okay, we are really about 2 minutes post-injection right now. Can you pull your big toe up and hold it up now? Can you see how much strength difference there is in just 2 minutes after that administration of a sub-anesthetic dose? Can you wiggle your toes for me? They feel like you have a little bit more movement in them?
Yes.
Well, that was pretty incredible, right? Interestingly, if you have a positive Phoenix sign, which means you get more motor strength after the administration of a small amount of lidocaine next to your common perineal nerve, you have a 90% chance of getting improvement after what's called a nerve decompression surgery. This is because this block and the response to this block is able to differentiate a problem coming from the central nervous system, which means the spine or the brain, or if it's indeed a true peripheral nerve entrapment. So if you have this problem, you can contact us at usneuropathycenters.com and see about finding a surgeon somewhere close to you who does this innovative peripheral nerve block. Thank you very much.